Hi, I'm Nikki McLam-Jones. I'm the Cardiovascular Accreditation Coordinator here at Piedmont Henry Hospital. What that means is I'm in charge of making sure that this hospital continues to have their chest pain center, and we are actually in the process of getting a heart failure center here also. So we're very proud of ourselves here, and we work very hard for our community. Today I wanted to talk to you about Go Red Month, which is February, and about cardiovascular disease. Go Red Month in the red dress is all about women, and it's about women's cardiovascular disease. Women do not present the same way as men present when it comes to chest pain, and we like to recognize that because we find that men have chest pain and they come on in and they want to be seen, and we're able to take care of them. Women think chest pain is something else. They think it's nausea or vomiting, or they think it's back pain, or they say it's jaw pain, or it's indigestion. So they tend to wait. So when they finally recognize that they need to come to the hospital, sometimes it's late. So we like to take this month to think about women and to remind women that you're important, and those symptoms that you're having are important too. We want you to come into the hospital and be seen, and understand that even if it's indigestion, or it's jaw pain, or it's back pain, or you feel like your kidneys are an issue, come on into the hospital. We don't recommend you really drive yourself in either if it's mixed with chest pain. We want you to call 911. We want you to call 911 because we want somebody to get you here safely. We want you to be monitored when you come here. We want, if there needs to be, anything needs to be done for you, that the EMS and our paramedics can go ahead and provide that care while we get you here safely. Once you get here, we're gonna speed you through this process of checking out that pain to make sure it's not chest pain. And we're gonna get you to the cath lab to make sure, if it is chest pain, to make sure it's not something major like an acute heart attack. That is the big deal. So what are some of the symptoms besides nausea and vomiting? Well, sudden onset of chest pain. Let's say you're gardening, or you're washing dishes and you're feeling chest pain, or you're nauseous all of a sudden, or you're having this jaw pain or back pain, and it's radiating down your arms. That's the time when you need to say, well, let me go ahead and call and make sure. We've had several women who've had acute MIs here, and they've done very well, but that's because they recognize the symptoms and they've come on in. So how do you live a healthy lifestyle? Well, what we recommend is that you do at least 2 hours, that's it, just 2 hours of exercise every week. Not every day, every week. We want you, if you have diabetes is very closely tied to cardiovascular problems and heart problems. We want you to make sure you're seeing your doctor and you're checking up and you're checking your blood sugar. Plenty of activity, fruits and vegetables. If you smoke, this is the time to stop. Smoking is very closely tied to cardiovascular issues. So smoking is the one thing that you can affect yourself, and you can make a big difference in that change. So stop smoking if you are smoking. There are a lot of programs out here, and we at Piedmont, we have a program. So if you want to call into our main number, or you want to look at us check us on the web, go ahead, look us up. We have plenty of programs that can help you stop smoking. During this month, Go Red Month, Piedmont Heart Institute and Atlanta Heart Associates do a free cardiovascular screening for women. So you can go and make a phone call to both of those offices, and you can be seen. What they'll do is they'll do blood work. They will do what's called an EKG to check your heart functioning, and they'll do a nice physical assessment of you. That will be done by a cardiologist to see what your risk factors are, to see how healthy you are, to see what your heart health is. If you haven't had a checkup in a while, this is a great time to do it, and for $99 you can't beat that. And then lastly, I just want to say, we at Piedmont Henry Hospital, we care about our community. You're important to us. We want you to be safe. We collaborate, and we do hands-only CPR. We do a lot of screenings and a lot of events where we're out in the community. That's just designed so that we can keep an eye on you, let you know that we're here for you. If you need something, we're here. And remember, 1 in 3 women will experience some kind of heart condition in their lifetime. And heart disease remains the #1 killer of women in this country. So know your risk factors. Know your numbers is what they call it. If you haven't seen your physician, go see your physician. Schedule an appointment today. And remember, we thank you for choosing Piedmont Henry Hospital.